Hey guys, this is Chris Dewey with May River Medicare, and today we're going to have some laughs. I am going to talk about a serious situation. Does Medicare cover Viagra for sex? And the answer to that is yes, maybe, perhaps. We're going to get into it, but we're going to have some fun because in 2016, Representative McLeod, she's a legislator in Columbia, South Carolina. Why is it that South Carolina is the only state in the country, I think with the exception of Kentucky, that does not allow men to use Romans or lemonade or blue chew or Hims to order affordable Viagra? And you cannot do it in South Carolina. We're going to have a lot of fun talking about why. We're going to talk about the new Alzheimer study and how folks, they looked at 7 million different claims and why there's great news on the horizon for Viagra being used for the prevention of Alzheimer's disease as well. All right, and then please, below this video is the subscribe button. Please subscribe to it, like it, share it with a friend if you enjoyed this video. This is the first video I've ever done where I've had a lot of fun, just a lot of laughs. I hope you guys enjoy it as much as I enjoyed making it, so please subscribe below and let's get into it. Take a deep dive into what is on every senior's mind, which is this. Does Medicare cover erectile dysfunction medications? This is a very sticky situation for both insurers, Medicare, and you guys. But what is the long and the short of this very hard issue? Why such rigid points of view from the left to the right? Does Medicare cover boner pills? The answer, my answer, is no, maybe, and well, perhaps. So original Medicare does not cover Viagra for recreational activities. What, like Scrabble, origami, poker? No, for Pete's sake, call it what it is. Original Medicare does not cover Viagra for sex. For some of us, sex is not recreational. It's a lot of pressure. It's not a game. It's work and a lot of wishful thinking. Medicare drug plans will cover Viagra for certain heart conditions like pulmonary arterial hypertension, which is treated with a drug called Revatio. Revatio is the brand name for sildenafil, but it's specifically treated for pulmonary arterial hypertension. So let me put my Medicare agent hat on. If you want to ask your doctor to prescribe the brand name Revatio and to indicate dispense as written or a DAW, that's important that you have the language in the prescription. So I'm guessing with pulmonary conditions, you don't want the generic crap. Make sure your doctor writes a 30-day prescription for Revatio. So also, guys, in most states, you can get a prescription for your doctor or even call a telemed service through Romans, Hims, the lemonade. You can order that Viagra at a very reasonable price since your drug plan or your Medicare Advantage plan isn't going to cover Viagra for sex. So a lot of my local clients in South Carolina, which is a huge anti-erection state, Kentucky also anti-erection. I got some disturbing news for you guys. And our research team just looked this up recently. And perhaps this is the main reason why men in South Carolina cannot, I repeat, they cannot order Viagra or sildenafil using one of those online services like Hims or Romans or Lemonade or the multitude of commercials that you see on TV. So a guy in a low fixed income whose Medicare isn't paying for Viagra for sex has to look for alternative methods to get this Viagra cheap. And let me tell you something, this politician, she's screwing women over too. Because the reality is women, the longer that they have recreational activities, the longer they have sex, they have less anxiety, they have less depression, they're a little bit more balanced, they're healthier. So this lawmaker in 2016, this is the history going to why we can't order stuff off of Hims or Lemonade, Representative Mia McLeod, who did state that her bill is symbolic. The Columbia, South Carolina politician wants to make a point. She wants to make the point that lawmakers have no business regulating men's sexual lives and they should stay out of reproductive issues. All right? So what if men seeking erectile dysfunction drugs in South Carolina had to go through the same process as women seeking abortions? That's her point. That's her question. That's what she's asking us. I purposely tried to make it as invasive, as intrusive, as hypocritical, and not unnecessary as possible to make the point she said. You know what I say to Miss McLeod? What about the sexual health of the wives of these male-dominated legislatures? What did they do wrong? They're innocent victims. Did you consider their feelings or mental health at all? You know what? Let's face it. Sex makes you live longer. The health benefits include improved brain function, brain health, immune function, lower rates of stress, and cardiovascular disease. For God's sakes, for some women, that's the only cardiovascular they get. The 2016 South Carolina bill, which caused our great state of South Carolina to be one of the stiffest, the staunchest anti-erection states, put the following steps in place for men. And we need to understand the history to get to where we are today, and that's why I'm bringing this up. I'm in South Carolina. I'm taking it personally. I think we have a right to know what happened. So the following are just some of the steps that men would have to complete before gaining access to ED drugs. These are the following. Obtain a notarized affidavit in which at least one of the patient's sexual partners affirms that the patient has experienced symptoms of erectile dysfunction during the last 90 days preceding the affidavit's date. And I find it interesting that they want at least one of the patient's sexual partners, at least one. So I'm thinking, I'm smart, I'm a crafty man, and I realize we got a better shot at getting this stuff, passing the interview, if we had at least maybe two or three ladies testifying on our behalf. You know what I'm saying? I can just imagine. Honey, this is Agnes from down the street. Remember we had that really fun Halloween party and we all jumped in the pool? Agnes, why don't you take over? And Agnes explains that he was not up, he didn't do well in water. And so that's where we're going with this kind of legislation. If I'm waiting in line at the South Carolina Department of Erectile Dysfunctionality, waiting with my wife or any other woman, kind enough to vouch for my flaccidness, waiting to get my notarized boner affidavit signed. So, if you're even able to pass the first step, which is getting someone to testify, your wife or somebody, that you've had erectile dysfunction problems in the last 90 days, it's not over with there, guys. Now we're going to phase 2. Phase 2 is you'll be referred to a sexual therapist licensed by the State Board of Examiners in Psychology for an assessment of the possible causes of the patient's symptoms of erectile dysfunction and obtain a written report in which the therapist concludes that the patient's symptoms are not attributable solely to one or more psychological conditions. And to me, I think pretty much 90% of erectile dysfunction can be sometimes as a result of psychological issues going on upstairs. That's just my one man's opinion, but I can just picture myself. Can you imagine you're at step 2, your wife said, yep, it's breaking us apart, you can't get it up. The person that's in charge of that at the Erectile Dysfunction Department of South Carolina, she says, yep, I believe it. Now you have to go to a sex therapist. So I can just see myself sitting on the couch, relax, Chris, tell me what's going on. How are things going? Well, it all started years ago. Back when I was married, I was dating this older, kinder, nice lady. And anyway, I got my hands on some Viagra. I wanted to try. I didn't need it. I was only 34. But Doc, I just wanted to for shits and giggles, try it out. I tried it out, and this woman said something that changed my life. She said, wow, that was different. That was better. You felt fill in the blank. And from that day on, I have not been able to have sex without Viagra. And that's where I'm at right now. And you know what? If you say shit like that, rejection, that was caused by a psychological condition, not a physical condition. So boom. So you get through the second phase, and now you're on to the third phase. Guys, this was almost legislation. And the remnants of it are why seniors in South Carolina have to go through GoodRx, or they have to find a unique way of paying for Viagra because it's expensive if it's not covered. So anyway, once you get through the sex therapist, this politician. I'm not going to say if she's a Democrat or Republican. She's just a politician, and I think her motivation for doing this was to compare it to women's rights, and it's actually, when we start going through this, it's quite powerful. And you have to attend 3 sessions of outpatient counseling. Hey, Nina. Wish you guys could see my Nina. She's a Labradoodle. Within a period of 6 months after the drug is prescribed, to ensure the patient's understanding of the dangerous side effects of drugs intended to treat the symptoms of erectile dysfunction, and consider celibacy as a viable lifestyle choice. Well, guys, celibacy honestly could be the right answer. I think there's something to say for celibacy if you can, if you can last more than a couple days. All right, so Miss McLeod. Okay, guys, so Miss McLeod, the politician of South Carolina, did not get all of the erectile dysfunction legislation passed the way she wanted, but the long of the short of the long of it is this. She did get part of it into the South Carolina new telemedicine law that was passed June 6th of 2016. So basically they were able to squeeze in a little piece of that. If you look down here, it says Schedule 2 and Schedule 3 prescriptions. That would be like controlled substances, I guess, like opioids or attention deficit disorder meds like Adderall. And they added lifestyle medications, including erectile dysfunction drugs, are not permitted unless authorized by the Board of Erectile Dysfunction of South Carolina. No. But seriously, if you look below that, prescribing women's health-inducing drugs is not permitted. So I do believe that political stunt did gain some momentum, and they did they make it very difficult for men to continue to get Viagra in a cost-effective way. All right, but here's the good news. You got GoodRx. If I tell my clients this all the time, if you have a Medicare supplement and a standalone Part D drug plan, always get a GoodRx. There's single care. There's a bunch of free services out there. And a lot of times, GoodRx will save you $40, $50, $60, $100 cheaper than the Medicare Part D drug plan or the drug plan that's found in your Part C Medicare Advantage plan. So always use GoodRx for drugs that are not covered by Medicare, your Part D drug plan, or your Part C, your Advantage plan that's got the drug plan built in. All right? So 2 last huge points regarding Viagra and Medicare. So the first point I want to talk about is the emergence of Medicare Advantage plans using the generic for Viagra, sildenafil, to entice you into getting a Medicare Advantage plan and getting off of original Medicare. Remember, Medicare is not Medicare Advantage. Medicare Advantage is certainly not original Medicare. What do I mean by that? If you got to watch out, you see Joe Namath, you see celebrities, you see that crazy old lady Martha on the commercials, and they're talking about free this, free dental, free vision. Well, finally, the folks at these Advantage plans that run them figure something out. They're like, hey, we got another great cherry on top for folks on Medicare Advantage plans. The most primal instinct man has. Let's start using Viagra as a means to entice men to get a Medicare Advantage plan with an $8,500 max out of pocket, with denials for routine medical procedures like MRIs. Even worse, skilled care. Skilled care is a big one for Medicare Advantage where they just don't want to pay it. And they want preauthorizations. Your doctor says you need to go to skilled care. No, the doctor at the insurance company that manages that Advantage plan says, no, I don't know if you really need to do that. You could just go home. So these are things you want to take advantage of. Don't get an Advantage plan because they're going to offer you 4 sildenafil. Now, here's an example of a plan. Again, guys, Medicare Advantage plans, I use those frequently for people under 65 on disability. Medicare Advantage is the only way to go if you're under 65. All right, if you're 65 or over, you don't want to be suckered into a Medicare Advantage plan where you can't go to the Mayo Clinic. You can basically go to local hospitals. All right, but here's what they're offering. Our plan offers additional coverage of some prescription drug. Our plan offers additional coverage of some prescription drugs not normally covered on a Medicare prescription drug plan. Covered drugs include sildenafil, the they're going to give you 4 tablets per month. I don't think that's enough, do you? You need at least 8 for most of you folks over in Sun City, at least 8. So they give you 4, big deal. You get 4 Viagras, and I showed you earlier where you can actually get, right on this screen, you can get, well, they're not going to give you 30 tablets. I've never seen a doctor write out 30 tablets for 30 days unless it's for arterial hypertension. But what they're saying is you can get a 1-month supply for $27. I don't know if that's going to be 30 tablets. You're probably going to get, I don't know, 6 maybe. A friend of mine told me that. You're probably going to get about 6. All right, so that's it for GoodRx. Also, there's a link below this video. If you click on it, I will give you access to the only credible Canadian pharmacies out there that are rock solid, where my clients do order Viagra from there. They do order Eliquis and Xarelto and Genumet and a lot of different drugs that are so expensive in this country. Okay, guys, the second big, huge announcement about Medicare and Viagra, specifically a scientific study with Viagra, was done by the Cleveland Clinic. And researchers there, what they did was they de-identified millions. I'm talking north of 7 million claims from 2 databases, all right? Now, this is what the Cleveland Clinic said. It revealed that there was a 30 to 54% reduced prevalence in Alzheimer's disease diagnoses among patients who took sildenafil, the generic for Viagra, compared to those who didn't. That's great news. Sildenafil was shown to lower levels of what's called neurotoxic tau proteins, which are associated with Alzheimer's disease, according to the Cleveland Clinic. Now, it also found that neurons treated with sildenafil expressed genes related to cell growth, improved brain function, reduce inflammation, and other processes known to protect against the neural degeneration associated with Alzheimer's disease. Researchers hope this drug could help Alzheimer's treatment in the future. Now, as far as repurposing goes, this very well may happen. Keep in mind, Viagra was not for erections. It was specifically designed initially for folks that had arterial hypertension, that had heart issues or artery issues, or it was a drug that was prescribed by cardiologists. All right. Excuse me. So, what do you think the drug companies are doing now? They're going to repurpose this baby, and they're going to repurpose it so that Medicare Part D or the drug plan in your Advantage plan will cover it, as long as it is for the prevention of Alzheimer's, or if you have Alzheimer's, to lessen the effects of the disease. So just keep in mind, make sure you got your life insurance policy all taken care of before you decide to trick your doctor into, I've been forgetting to put where my keys are. My wife says I'm really forgetful lately. I heard the drug commercials, the pharmaceuticals said I should ask my doctor if I'm being forgetful, if maybe you should, maybe you should prescribe this for Alzheimer's. Well, okay, guys, so yeah, just remember, if down the road they repurpose it, you go to your doctor, you see a Viagra commercial for Alzheimer's, you decide, hey, you know what, I got a loophole around this, I'm going to get them to cover our Viagra, honey. And you laugh about it, you go to the doctors, and he prescribes you Viagra for Alzheimer's when you really don't have Alzheimer's or any signs of it. You will be stuck on the Medicare supplement you're on for the rest of your life, all right? Because that will go into the Milliman database, and then when they do a med check, that will pop up. Oh, what is sildenafil for? That's for the prevention of Alzheimer's. You will stay on that Medicare supplement. We will not be able to shop out rates every year like I do for all my clients. And it's just not worth doing that when there are other methods. You can use Canadian, you can use GoodRx. So it's just not worth it. And I can only imagine what the warning. It's not going to be if you have an erection for more than 4 hours, you could go to the emergency room or hospital. It's going to be more like for seniors that are taking Alzheimer's to prevent Alzheimer's disease. Warning, do not attend a neighborhood pool party and avoid the beach for 4 hours after taking Viagra. And that's what the commercial will probably say down the road. They haven't repurposed it yet, guys. But again, if you learned anything from this video, you learned 3 things. Number one is, if you decide to go, if you have a choice between a supplement and a Medicare Advantage plan, don't go into a Medicare Advantage plan for the freebies, the cherries on top, the free dental, the free vision, and now free sildenafil. Don't do that. It's a huge mistake. If you can avoid going on a Medicare Advantage plan, do it. If you're financially strapped, you're on Medicaid or extra help, I understand that. If you're under 65, Medicare Advantage is the right call. All right. Also understand that when you have a Medicare Advantage drug plan or you have a Part C drug plan built into your Advantage plan, you can use Canada, you can use GoodRx, you can use Single Care. There are a multitude of different avenues where you can get drugs many times cheaper than your actual Medicare drug plan. Guys, I hope you enjoyed this. I made it a little entertaining, had fun with it. Right below is a subscribe button. Hit the subscribe button, like my video, share it with some friends. Had a little bit of fun this time around. Maybe I'll do another one like it soon. You guys have a great day. Bye-bye.